You can go live now.
Very good morning, dear doctors. On behalf of Hetero Healthcare, I, Dr. Prashant Kante-Barkar, welcome you to this webinar, Unveiling Polmacoxib, the current experience and future opportunities. Doctor, in Hetero, we know orthopedic is an important therapy segment. We have introduced several NSAID patches, and recently we have introduced Polmacoxib. Now, Polmacoxib we know is being used as an anti-inflammatory drug being used for inflammatory conditions. And today, to share clinical experience on Polmacoxib and throw more light, we have got Dr. Samir Sarda with us. Welcome, Dr. Samir. Dr. Samir Sarda is a consultant rheumatologist at Sarda Center for Arthritis and Autoimmune Rheumatology. Sir is MD Medicine, postgraduate fellowship in rheumatology. His fellow in rheumatology from Sion Hospital, Hinduja Hospital. Dr. Sarda has published several articles in index journals, has presented paper in poster presentation in both national PG conventions. To introduce, to throw more light on Hetero, we have our general manager, Mr. Manohar Inarkar. I welcome Mr. Manohar Inarkar. Thank you, sir, all to you.
Yeah. The slide is visible?
Yes.
Thank you, Dr. Kante-Barkar, for this nice introduction. Here, on behalf of Hetero Healthcare, I welcome all the delegates for this webinar on Polmacoxib, the current challenges and the clinical experience sharing. To start with the Hetero Healthcare, I'll just take you through the Hetero Healthcare, what Hetero Healthcare is about. Hetero Healthcare, being an innovative pharmaceutical company, the journey started in year 1993 and overall 30 years of excellence in offering the innovative healthcare solutions. Almost 36 state-of-art manufacturing plant facilities Hetero is offering and 300 plus product portfolio. And we have the presence in almost 126 plus countries. Globally, almost 21,000 employees Hetero Healthcare is having, and we are the largest closely held pharmaceutical company in India. Among the largest manufacturer of the ARVs, that is antiretroviral, APIs, and the FDFs in the world. So Hetero is the Asia's largest APIs manufacturing at the Special Economic Zone complex, that is Visakhapatnam, Andhra Pradesh. In addition to that, Hetero Healthcare is a 360-degree solution provider. We are reaching to our customer across India with a wide product range at that encompassing the multiple specialties and pioneering in quality and innovation. So Hetero Healthcare offering the distinction of bringing the 4 biosimilar products to market within 5 years of initiation, that is darbepoetin alpha, rituximab, bevacizumab, as well as adalimumab. During the COVID era, we are the pioneer in offering the antiviral solution. And as we all know, during the COVID era, it was basically the Covifor, that is remdesivir injection, which has given a great identity to the Hetero Healthcare. Along with that, in case of whenever there is a swine flu, we are the first one to launch the oseltamivir in the Indian market with brand Fluvir, as well as the favipiravir. We are also offered during the COVID period. For this particular, during the services which we offered during the COVID period, we received the award of Pharma Excellence in August 2020 for COVID drugs. And in addition to that, Hetero Healthcare feel proud to share with you our sister concern company, that is Agista BST Aerospace, a sister concern of Hetero Healthcare. They have successfully launched the first microsatellite on 13 June 2023. This satellite is generating the images to support the maritime surveillance and the crop monitoring. And we feel proud to share with you that company is also geared to launch 10 more such satellites and to create the milestone in the aerospace also. We also offer our unique services under the campaign, that is We Care For You. As a doctor cares for the patient, we also care for a doctor, and it is a bond of care, love, and trust. So as a doctor, we strive to keep the nations healthy. It is the effort by the Hetero to keep the doctors healthy. So the product which we are offering is a made in India and made for Indian. And under this We Care For You offerings, we are having the quick mints, which basically to experience a healthy and fresh breath. Spice sip as a product, that is a refreshing spice sip with the advantage of curcumin, black pepper, and cinnamon. In addition to that, we also offer the Taste Good biscuit, which is enriched with the calcium and vitamin D, as well as the Karela biscuit, which will take care of the blood sugar level. Not only that, Hetero Healthcare in ortho segment offering the various products for trauma management. We having the brand that is Tolic for the management of the neuropathic pain, and having the Hetero PG, that is Polmacoxib with the pregabalin. And for joint, tendon, ligament, cartilage management, we have the brand like Vicin and Nifal. For a fracture management, we are offering the Scissors, Quadrangularis, and along with that, we are having the Moringa oleifera. Vitamin D for the to strengthen the bones. We are the first one to launch the ibuprofen, that is 400 ml for the surgery-related pain, and entire basket of the pain management we are having. So the entire basket is offered by the Hetero to take care of the ortho pain and management solution. Dear doctors, we also feel proud to share with you that we are launching the first time in India, made in India, made for Indian transdermal patches. So the concept of transdermal patch and the utility of the same, we are marketing in India to take care of the pain management, which is definitely having a good efficacy as well as the safety aspect. We are currently marketing our K plus patches, that is ketoprofen patches, and diclofenac 100 and 200 mg, that is trans deep. So this innovative solutions which offered by the Hetero Healthcare definitely is going to ease the bringing the more quality of life of the patient, and this is what the total introduction from the Hetero Healthcare. So in addition to that, we also feel proud to share with you the Hetero Healthcare did the first clinical trial for the Polmacoxib, and we are the first one to launch the brand Polmacoxib in Indian market. So with this brief introduction of Hetero Healthcare, I'll request Dr. Sarda to start our today's webinar. Over to you, sir.
Thank you, Manoj. Good morning, everyone. I'm Dr. Sarda, consulting rheumatologist at Akola in Vidarbha, Maharashtra. I briefly want to introduce this new promising drug called as Polmacoxib, which is brought by Hetero Pharma by brand name of tablet wheel, capsule wheel 2 mg. Can we have slides, please? Yeah. Next slide. Again, next. So this is the issue which every one of us face in our clinical practice, maybe be it orthopedics, be it rheumatologists, even be it physicians. Osteoarthritis is upcoming or much seen patients of degenerative joint disease. Most common involved joints are knees. Other joint involved are maybe hips, small joints of hands, osteoarthritis hands. Even shoulders are the joint that get involved. So it is upcoming most common form of arthritis. Worldwide prevalence is about maybe 3.5%. In India, it is second most prevalent joint disease, affecting maybe up to 30% of the population. First being inflammatory joint disease, second being degenerative joint disease like osteoarthritis. Next slide. There are many risk factors. Most modifiable and most common risk factor is obesity. More the weight, more is the pressure on knee joints, and more is the degenerative changes. Second is lifestyle. Maybe more people who sit cross-legged even after age of 50, females especially after menopause, and males after 50, 55 years of age. Some occupational condition causing more wear and tear of knee joints, like people like athletes or those who have prolonged standing or prolonged walking. Many comorbidities like diabetes, hypertension itself contribute to degeneration of joints. And diet, yeah, that is major factor. Not taking proper diet that would help degeneration to be less is major modifiable risk factor for having osteoarthritis. Some non-modifiable risk factors are age. Like I have said, post-menopausal females and males above age of 50 have more chances of degeneration. Gender, of course, female population have more degenerative changes than male population. Some genetics play a part, like it runs in families, more seen from grandmother to mother to daughter. And race. Race is another non-modifiable risk factor of osteoarthritis. Next. There are many risk factors or many things that contribute to having osteoarthritis. Mechanical stress, like we said, more prolonged standing, more prolonged walking, overweight, other risk factors, various risk factors like we have discussed, non-modifiable and modifiable risk factors, and abnormal joint mechanics. Maybe some trauma causing abnormal joint movement or joint range of movement is deranged, that can again contribute to more degeneration than normal population. Next. There are limitations and challenges in treatment of osteoarthritis, like we cannot use NSAIDs for very long time. The non-selective NSAIDs which were used for in previous era, they have more side effects. Next is not next injectable intra-articular steroids is again a option for very short treatment plan, but it won't help in long treatment management. And also the risk factors, like we say, obesity, it is a thing that won't go away very fast. So there are many limitations and challenges in treatment of osteoarthritis. Next. Like I have just discussed, NSAIDs and COX-2 inhibitors have many uncertainties and potential health risks. Like traditional NSAIDs, they cause GI intolerance, gastritis, cardiac issues like hypertension, edema, and many other potential risk factors. So even renal damage is one of the major potential risk factors of traditional NSAID or non-selective NSAIDs. Now the COX-2 inhibitors which are in market like Etorecoxib, Celecoxib, they are very good drugs. But issue of GI tolerance is less with this specific or selective COX-2 inhibitors. But issue of hypertension and CV abnormalities or cardiovascular issues and also edema is still ongoing with this COX-2 inhibitors which are available in market. Again, pain relief and joint damage, treating both aspects is again difficult because with NSAIDs we cannot continue treatment with NSAIDs for very long, and joint damage will continue because of modifiable and non-modifiable risk factors which are prevalent. And also the nutraceuticals which we use, they have a very limited scientific base of maybe whether they work or not work. That is again still a very questionable thing. Surgical intervention, most people are not ready. Most patients are not ready for surgical knee replacement surgeries. Even post surgeries, though there is clinically great improvement, but still there are limitation of activities, like you cannot cross leg sit, you cannot do knee flexion movements, and maybe some have only marginal improvements. Next. So we will talk about this most promising drug that have come up in market, Polmacoxib. I have personally used it in few osteoarthritis patient, and also I have used it in few rheumatoid arthritis and also spondyloarthropathy patient in our rheumatology setup. I have found this drug to be very much effective. Though it is very short time when I can exactly comment on whether this drug is better than Celecoxib or Etorecoxib, but still the short time which I have used, I have found it to be very promising. Next slide. I'll introduce this drug in short. It is a novel NSAID. It is a selective COX inhibitor, and it specifically inhibits two mechanisms. It inhibits specifically the COX-2 inhibitor, and it is also a carbonic anhydrase inhibitor, that is carbonic anhydrase 1 and 2 inhibitor. So it is very useful in treatment of pain management in arthritis, maybe osteo, rheumatoid or spondyloarthropathy. Next. So what is the mechanism? Like I have discussed, it is it has dual mechanism of action, like inhibiting COX and also inhibiting carbonic anhydrase. Now, what is specific about this mechanism? Now, like we'll compare it to Celecoxib and Etorecoxib. Celecoxib and Etorecoxib are specific COX-2 inhibitors. They are not having any carbonic anhydrase 2 inhibitor activity. Now, what is a good thing about carbonic anhydrase 2 inhibition? It is many tissues are highly enriched with carbonic anhydrase 2, like GI tract, blood, and kidney. So Polmacoxib, we'll have next slide. So Polmacoxib specifically bind to this carbonic anhydrase in red blood cells. And it specifically binds in tissues like GI, blood, and kidney. And it shows, so what happens, this RBC transports this Polmacoxib in protected and inactive state to tissues with low CA activity, like maybe mainly joints. So it is a benefit to us, like it has lower side effects in GI and cardiac things, even in kidney, but it has more effect in joints, in inflammatory, inflamed joints. So it dissociates from carbonic anhydrase in joints, and this drug, which we specifically want to work in joints, have more increased concentration in inflamed tissue. So this is again a very good mechanism, and it is the drug has very low systemic exposure because of this carbonic anhydrase binding. And also because it inhibits COX-2, it has very less GI side effects in preventing from gastritis and acid peptic diseases. Next. So we'll talk about pharmacokinetics. Its whole blood concentration is 50 to 70 times greater than that of plasma. And median Tmax value, like what we expect to work, is about maybe 7 to 8 hours. We'll see the maximum effect of this drug. And also 100 hours is the T half. So it is the drug that will act for very long time even after starting. So there would be good plasma concentration of the drug for much long time. And it shows dose proportionality. So that is a good thing. And maybe this is something genetics, like men have a slightly higher T half than women. Next. So there are phase 3 studies where we have talked about the safety profile of this drug. So the adverse effect, that is TEE, that is treatment emergent adverse events, are mild with the specific COX inhibitor. The safety profile is better than celecoxib, etoricoxib, or we can say it is almost similar, but it is less than placebo. So it has less GI side effect as compared to other NSAIDs. Next. The drug is well tolerated, like I have said, and it has good effect up to up to 6 weeks. So this is almost up to maybe we can say up to 6 months. There is good effect of this drug. We have seen many trials which I have read, they have used it up to 6 months also. But 6-week treatment is initial treatment protocol which we can follow without expecting much side effect. And with very less TE, that is adverse events are very less. And after 6 weeks, we can just monitor ECG of the patient, a few lab parameters like kidney function test and the physical examination and vital signs, which can help us detect if any side effects of this drug are coming after 6 weeks of treatment. Next. So it has superior efficacy to placebo, and it is not inferior in safety and efficacy as compared to other selective COX inhibitor like celecoxib and etoricoxib over 6 weeks of period. The 18-week trial extension also showed good safety profile and good results. Like I have discussed, it is seen in few studies where it has been used up to 18 weeks, but still we are in very initial phase of our clinical practice, and initial usage of the drug have shown very good promise and least side effect, maybe up to 2 to 3 weeks as per what I have experienced. Next. So we will just summarize about this drug in short. It is NSAID, that is selective COX-2 inhibitor, and it has good effect in osteoarthritis or degenerative arthritis. But what I have seen, it has also good effect in rheumatoid arthritis and spondyloarthropathy and other psoriatic arthropathies also. It has the most beautiful thing about this drug. It is just once a day treatment protocol is used. That is, it is to be given only once a day, like other NSAIDs. Maybe it requires BD or TDS dosing also, but it is to be used only once a day. And dose is not to be exceeded above 1 tablet, that is 2 milligram of capsule. So it can be administered after meal. The major drug interaction of this drug is with ketoconazole, so it has to be because it is CYP3A4 agonist, so it has to be used with caution with ketoconazole. ACE/ARBs on patient with ACE/ARBs for hypertension management. Again, one more important thing, like I have used this drug with leflunomide. I have not used this drug with methotrexate or cyclosporine or tacrolimus. So because of this drug interaction, that it has drug interaction with anticoagulants, some corticosteroids, some interaction with methotrexate, cyclosporine and tacrolimus. So caution is to be given while used, or what one we can do is use a low dose of methotrexate and give Polmacoxib with this drug. It is contraindicated in patients who are allergic to sulfa or sulfonamides, and also uncontrolled hypertension with old cardiovascular comorbidities, and also with ischemic heart disease, peripheral vascular diseases. It is not to be used in pregnant and nursing women, and also in geriatric age above 70 and pediatric above 18 years, because not sufficient data has come up for this drug in use in this specific population. And also the thing which we have discussed, it has got interaction with anticoagulation, specifically coumarin type anticoagulation. So it is to be used with caution in patient with blood coagulation disorder and taking anticoagulation. Next. So just key takeaways that we have discussed. It is a specific COX-2 inhibitor and also carbonic anhydrase inhibitor, dual mode of action. Because of this dual mode of action, it reduces the side effects like GI and cardiac side effects, and patient have less chances of hypertension and CV abnormalities, cardiovascular abnormalities, and also less chances of edema. It is well tolerated for maybe up to 6 weeks and in trials up to 18 weeks, and it is safe for long-term use like we have discussed. Okay, thank you.
Thank you very much, Dr. Samir.
Thank you.
There are a few questions coming out. Can I start asking? Manor,
Yeah.
I'll start asking the questions. So one of the question is that how fast do you see symptom relief?
What I have seen in my patients of osteoarthritis and rheumatoid arthritis, after giving maybe up to 3 to 4 days, we see pain is getting relieved, because just we have discussed kinetics that its T max comes in maybe up to 7-8 hours, and also it has very long half-life, like maybe we'll say up to 100 hours.
Correct.
So the effect comes very fast, maybe in 3 to 4 days, and also it is dose dependent. Like as soon as you stop, maybe in 3 to 4 days, the effect will go away.
Of course, it's too early to ask. Is the symptom relief as fast as with Heterocoxib or diclofenac?
Yeah. We can definitely say it is as fast as
with this. And amongst others, all the signs of osteoarthritis like stiffness, restriction of movement, limitation of reach, which are the symptoms which get relieved very fast as compared to
pain and stiffness are the first thing that get relieved very fast.
Even stiffness and range of movements also get over a period of time, maybe.
Again, I think this is more because of degeneration. So there would be some because of underlying degeneration.
Absolutely.
But pain and stiffness, that the part that gets relieved is very what we can say. That thing makes happy to patients. That is a thing that patients want very fast.
Correct. Doctor, what is the analgesic potential of this drug? Like inflammation, we know it relieves inflammation. What about analgesic activity, pain relieving activity?
It is very promising. It's almost similar to celecoxib and etocoxib.
Okay. And did you require, use of paracetamol any time with this drug? Maybe in acute cases, maybe in...
No. I have actually, to be very honest, I have never used paracetamol in acute conditions.
Okay, that's wonderful.
I don't feel it is used. It is very helpful in very severe pain.
That's wonderful.
Because we can say in future treatment, like once you relieve the pain and inflammation, and after that for maintenance therapy, paracetamol can be used.
That's right. That's understandable. What is the gastric irritation potential of this drug as compared to diclo or maybe etocoxib?
Specifically, gastric potential or gastric irritability potential is very less. It's very less. This drug, Polmacoxib. Even with celecoxib and etocoxib, it is less, but still what observe, it is most less with this drug. Maybe because of OD dosing, we take it once a day for a very long time, and also the mechanism which we have discussed, it is a carbonic anhydrase inhibitor. So
correct.
It doesn't come in GI, it comes more in joints.
And you required any time to give a PPI or maybe H2RA along with this drug?
Thing is, I generally prefer giving PPI. Reason is on multiple pills for maybe this drug.
Absolutely.
Even in our rheumatoid condition, some immunosuppressant, some corticosteroid. So for giving, but maybe in future when we'll continue this drug and we'll reduce dosage of other drugs, I think we can maybe give a trial of switching of PPI and antibiotics.
Yeah, and sometimes if gastric irritation occurs, patient summarily stops all the medications. That also happens. Any specific time you prefer to give this drug, or any time is okay? Maybe morning.
I prefer after dinner at bedtime.
Okay. Osteoarthritis is said to be worst in the morning.
Because stiffness or after inactivity.
Correct.
It creates stiffness, so it will work better with what we can say. The 10 hours of Tmax is something will be helpful.
You get the best relief. And you have generally prescribed for 6 weeks, like you were saying in your presentation.
I have, so this is the trial that have come up, like 6 weeks to 18 weeks.
That's
But I have just started using it in maybe 3 weeks or 4 weeks, and I have very instantly good results.
And what appealed to me is that after 3-4 weeks, you again evaluate the patient in terms of finding out ECG, doing some tests, and see how the patient is doing. That's very wonderful. Because that will give us an insight into patient's condition, how is he responding. Any untoward effect you have seen in this investigation?
No, not at all.
Not
Not
at all.
Polmacoxib. I have not seen even GI irritation in any patient.
Okay,
What thing I do, I just take blood pressure at baseline ECG,
absolutely.
and after that, if the blood pressure and ECG is normal and no dyspnea on exertion and no cardiac symptoms, I start Polmacoxib.
Absolutely, absolutely. I mean, that's, and this is just a, this is not a very specific question. Where would you prescribe analgesic patches that are available? You know, diclofenac patches, ibuprofen patches, or maybe ketoprofen patches. Where do you
I
prescribe?
use this in patients who have GI irritation, like
Okay.
patients who cannot tolerate oral NSAIDs or conventional NSAIDs or
Huh.
opioids. In that patients, I use this drug. And secondly, even patients who have edema with conventional or COX inhibitor NSAIDs, I
Okay.
specifically patches. And I have used K-Plast and Ketoplast patches, and I've got good result with ketoprofen.
Of course, there's one question. Does it work in rheumatoid arthritis?
Yeah, definitely. The thing is, whatever we say, any inflammatory condition have same things. It will be COX-1, COX.
Absolutely, absolutely. Even in musculoskeletal indications, theoretically, it should work. Theoretically, although there are no studies.
Though it has not come up in trial, maybe, but in
Yes,
future.
yes, maybe, yes.
Yeah.
It's currently recommended only for osteoarthritis, but yes. I think that is all currently from our side. It's been really wonderful sharing your experience, Dr. Sarda.
Thank you. Welcome.
I think that is all, Vijay. Any questions? If there's anything, Doctor, we'll come back to you.
Okay.
Thank you
Okay.
so much.
Have a great day.
Thank
have
you.
a good.
Thank you. You too.
So
Bye.
on behalf of Hetero Healthcare, sir, we would like to thank you for giving your valuable time and sharing your valuable experience with the audience. Definitely, audience will definitely make the best use of this particular clinical experience sharing in their day-to-day practice. And on behalf of Hetero Healthcare, once again, sir, thanking you for sharing your valuable time. Thank you, Dr. Gande Pakur. Thank you.
Thank you. Thank you. Thanks, Manohar. Thanks, Dr. Samir. All the best. Thank you.